Welcome. You're tuned into Life is a Sacred Journey. Every week, we bring a new perspective to aging and caregiving. Here is your host, Michelle Pope.
Good morning, good morning, good morning. Happy Friday to all of you out there in the virtual neighborhood of Life is a Sacred Journey. I am your host, Michelle Pope of Life is a Sacred Journey, and I'm just so thankful and grateful that you are here again this Friday morning. It's going to be a beautiful day today. I am still experiencing allergies. I've been experiencing them ever since, the weather started to change, but I still love the weather and just really excited about spring and summer and my birthday. I want a big shout out to Felicia Forrest, and I'm not going to pronounce his name properly. Felicia's going to have to train me. I am now for my beautiful bracelets. I don't know if you can see those, but my first birthday present for this year. So thank you. Thank you. One says, slow down, take it all in. The other says, courage is with you. And the other says, live, laugh, and love. Three of my favorite things to do. Well, let's get started today because we're trying to squeeze our time down to a half hour because we're finding that that's better for you all. So I'm going to try to do a better job at that. But this morning, I'm excited to bring back my friend, our friend here at Life is a Sacred Journey, Dr. Robert Pearl. Dr. Robert Pearl served as the CEO of the Permanente Medical Group, Kaiser Permanente, as we all know here in the state of California. He's also the former president of the Mid-Atlantic Permanente Medical Group. In these roles, he led 10,000 physicians, 38,000 staff, and was responsible for the nationally recognized medical care of 5 million Kaiser Permanente members on the West and East Coast. He is a clinical professor of plastic surgery at Stanford University. He's coming on in. I brought him out of the virtual neighborhood, so you'll be seeing him in a few minutes. And he also is on the faculty of the Stanford Graduate School of Business. He teaches and courses in healthcare and strategy. His website is amazing. And now you know this already because Dr. Robert Pearl has been on Life is a Sacred Journey. He was here for Mistreated, the book that he wrote, Mistreated, Why We Think We're Getting Good Healthcare and Why We're Usually Wrong, which was a Washington Post bestseller in 2017. He also wrote, this is actually one of my favorite ones, Uncaring, How the Culture of Medicine Kills Doctors and Patients. And again, this was a Kirkus Star recipient in 2021. And his newest book now, ChatGPT MD, How AI Empowered Patients and Doctors Can Take Back Control of American Medicine, April 2024. So it's a new book. It's out. I'm going to be ordering it. And the one thing about Dr. Robert Pearl that I need to continually share with you, that all the profits of his books go to Doctors Without Borders. So when you purchase a book, one, are you getting educated? Absolutely. Are you getting food for thought? Absolutely. But you're also supporting a great organization, Doctors Without Borders, that serves all over the world in these areas where medical care is is scarce and they need specialized medicine. So help me, my friends at Life is a Sacred Journey, in welcoming our good friend, Dr. Robert Pearl, to our conversation this morning. Good morning, Dr. Pearl.
Good morning. It's a privilege to be with you today.
It's so good to see you. It's so good to see you.
Great to see you again.
Yeah,
Yeah.
yeah.
Been too long.
It's been too long. It's been too long. It's so funny. I was reviewing Dr. Pearl when you and I first met, and we were at the very beginning of this pandemic now that it's still with us in some ways. We no longer describe it as a pandemic. It's taken on the positioning of like the flu or the areas where we get vaccinated. But we started our relationship at a time when we were scrambling those of us that provide medical care to those in our community. How are we going to do it? How are we going to do it? We learned about Zoom. Oh my God, we learned about Zoom. All of a sudden, we were doing assessments on Zoom when we never even thought that that was possible. Actually, there were bylaws and things that prohibited us from doing that in the medical care. Now it's become a very big part of what we do. And now, and then you came back on the second book, and you kind of hinted at Amazon being able to get your prescriptions through Amazon and all of this other stuff that is now kind of becoming a boom industry, and as well as helping to support medical care. And Chat GPT MD, how AI empowered patients and doctors can take back control of American medicine. This is what it looks like, friend. I haven't got my book, my copy yet, but I want you to see it. And I want you to go to Dr. Robert Pearl's website, which you can purchase the book there. And as I already told you, the funds, Doctors Without Borders, what an incredible thing. So buy 2 books, one for yourself, one to give away, and then you're supporting something that is a very near and dear organization to Dr. Pearl, myself, and those that that organization serves. So let's get into this. This is an amazing time, Dr. Pearl, in the history of our medicine, because we're beginning to understand how AI can support home care, can support the physician in remaining in contact. We have things that I have a friend that had open heart surgery recently, and they put all these things on him, and all of the information was going back to his doctor so that he could come home earlier. All of these great things, but I think we're still afraid because we don't understand GPT and AI. You know, they sound like wonderful sci-fi, Isaac Asimov things, but GPI stands for Generative Pre-trained Transformer. So you're going to have to dissect that and tell us how that fits in. And again, welcome, welcome, welcome to Life is a Sacred Journey. My heart is just pounding just seeing you back here again. So thank you.
Well, thank you. A couple of added thoughts before I respond.
Yes, please.
The first one I want to point out, and I know this is something that you're an expert around, is that although the pandemic that you and I focused on is gone, the residua remains. We're seeing issues with education, with mental health, physical health. So no one should dismiss this as, oh, that was unimportant in any way. We're going to be dealing with this not just for years, but for decades and probably generations. It's a different topic. Maybe we can come back to it some other time.
I really would like to, because I'm very concerned about the mental health impact that it has had on the youth and young adults that are in my life through my work in the church. And I'm just seeing a great, they've changed. I'll put it that way. And yeah, we need to have you back to talk about that, because that's important and real.
No question, and we need to invest in addressing it, but for another day. In terms of the website, it's robertpearlmd.com. If anyone wants to get more information, they can go there on the topics of today or other ones that we've discussed. So far, the book's been very successful. It's #1 on Amazon's new best books list. So I'm very excited about that. So let's talk about GPT. What is generative AI? What is AI? Let's start the very basic. We use the word AI as though it's only one application. No, there's been 3 different generations of AI, and they're all very different. About 1980 to 2000, we had rule-based AI. What this means is that computer systems were programmed by humans using what's called algorithms. This is how medical students learn. A patient comes in with a cough, and you learn to ask a question. Do they have a fever or not? And that puts you into 2 different categories. And if they, let's say, have a fever, is the sputum clear, which is more likely a viral, or is it a discolored, more likely a bacteria? And in that way, it comes to a diagnosis. The problem with rule-based AI, it can never be better than the people who programmed it. So it was reliable, it was a good tool, but it didn't have much of an impact. Then we get to 2000. Now we have actually biology impacting technology. We have what's called neural nets, designed around the way that our brain is structured. And it uses what's called deep learning. And it takes two large data sets. Take 10,000 mammograms, 5,000 of which show cancer, 5,000 of which are either normal or have benign disease. And then the application itself compares these two, finding subtle differences, putting in probability factors. And actually now the tool is about 10% better than radiologists, which is a nice thing. The problem with narrow AI is the name. It's narrow. It does one task and one task only. It reads mammograms. It can't read chest x-rays or brain scans. And medicine is too vast to develop what would be tens of thousands of different narrow AI. So generative AI comes along literally, well, about 2 years ago, it's released by OpenAI as ChatGPT, and it's completely different. Okay. Instead of training it on narrow sets of information, it's trained on everything on the internet, every medical textbook, every journal article. It knows a vast amount of information, and that's called the pre-training, the P in the middle of the GPT. Okay. But what does it do with all that information? It transforms it. These are parameters, they're rules. There are billions of them. As an example, pay more attention to a new article than an old article. Example, pay one from a peer-reviewed journal rather than one from a non-peer-reviewed. Look at something from the Mayo Clinic or Harvard or Stanford rather than just something posted. It provides a priority system, and using that, it now can answer any question. That's the G. It generates an answer. And I want to stress really one more thing for your viewers and listeners.
Yeah.
This technology does not just provide knowledge, it provides expertise. What do I mean by that? Well, if you look at the history of technology, you can go right back to the printing press, Gutenberg. It created books. Books have knowledge, but for you to try to diagnose your symptoms by going to a bookstore or a library and getting a bunch of books, almost impossible to do. The internet provides a lot of links. But what do you do with the information? You can get general information about diabetes, but what about your specific situation? How old are you? What is your occupation? What's your family history? It doesn't have that information. Generative AI is expertise. You can paint a picture that looks like a Rembrandt, even though you never had an art class. You can program a computer. You can write a song in the style of Drake and The Weeknd, even though you've never had a music lesson. And it's going to empower patients to now be able to make diagnoses using the technology, understand their diseases. And so it allows them to know better what to do, and it allows them to be a greater participant with their clinicians.
And that's the piece there that I think is so important that you raise. And actually it's the end of the formula for your other two books, where you talk about the partnership between the patient, the community, and the doctor, and how do we do that? It takes communication, and this levels the playing field in some ways, because then people are more aware of their own symptoms in their bodies. I remember as a child, my mother telling me one of the most important things I could do as I grew into my womanhood was identifying how my body felt, how it looked. She advised, look at yourself, stand, and because that's the only way that you can see the changes that may be happening, that may be a precursor to something that is a health issue. How do you feel? What does it look like? All of those. But then when you add, like you just said, the internet, which we're already doing anyway, right? We're already doing that. We're gathering all this data, but then you bring it together with a discussion with your doctor, then that's an amazing level of communication about any one given thing that might be going on. And I would think it would increase diagnosis maybe earlier for people so they're not sitting back waiting and thinking, oh, this will go away, and instead of really being on super vigilant about the symptoms that they're feeling because of what they're getting out of this system? And is that true or false? Am I making that up?
No, you're not making that up at all. But I do want to warn people that I do not recommend at this point, with the version that's available called GPT-4,
Okay.
that people take over their own disease management without assistance of a clinician oversight. That day is likely to be coming, by the way, in certain areas, because this technology is doubling in power every year. And that means that 5 years from now, it's going to be 30 times more powerful. That's your car going as fast as an airplane. It's a remarkable progress. And I want people to be ready for it. But what it will be able to do, and to some extent what it can already do, is to personalize that care. Let's just say it's 11 p.m. and a parent, a mom, a dad has a child with a fever. What should they do? Should they go to the emergency room where they know they'll wait an hour or two surrounded by people coughing with infectious disease, or wait to the morning when their child might not be living because they had a pneumococcal, because they had a meningeal infection? Right now, what do? They call the doctor's office, and what do they get? A recorded announcement: go to the ER. It's not about their child. It's just general information, really, to protect the clinician. Or they call the answering service. They say the doctor will call you back in the morning. I don't want to call in the morning. I need information now. So you can put it all in. As you said about your mother, how do you put all of the information in place? What is your child looking like? Is their neck stiff? Are they riding their bicycle around the living room or lying limp in a bed? That should determine exactly what you do. Yep. And now it can give you that advice. Is it going to be perfect? No. Is it going to be far better than what exists today? Absolutely, because today you have nothing.
Right.
I did a podcast earlier this week, and at the end of the session, the hostess, so it was a female interviewer, said to me, Dr. Pearl, I know you're a skier and you're a doctor. Let me just ask you, about 2 months ago, my husband fell skiing. He had his arm over his head. He slid down the mountain, and his shoulder is still really painful, and his arm doesn't work as well as it should. What should I do about it? And I said, I think I know exactly what he has, but why don't you put the information into ChatGPT, everything you can think of, and see the response that you get. I got an email about 3 days later. She said, thank you so much. She told me the diagnosis. It was the one that I thought. She told me the diagnostic test that was needed. And she said, ChatGPT said, most likely this needs surgery and it shouldn't be delayed. And she contacted an orthopedic surgeon who concurred with the diagnosis and the testing and said to him, had you waited several more months, this torn rotator cuff, which is what it was, this detachment of a muscle from the bone, might have been not easily repairable with a result that was far worse. It's good that you came in right now. That's the empowerment. The patient understands. They still can't make the final diagnosis. They still can't order the test. They still can't do the procedure. But now they can know what they need with higher understanding. You notice, you mentioned earlier, you go to Google, you click on a variety of links about diabetes, you get a general answer. Put in all your information, your family history, your medications, your laboratory results, and maybe even your entire genetic sequencing. And ChatGPT can give you a far more precise answer. Again, today, it's just background and education. In the future, I think it will be actual medical assistance.
Well, I'm a sci-fi buff. That's why I could easily say Isaac Asimov, because that's where I started. And a lot of the movies, books that I have read, this really is where they were saying we were going to be in the future, where one movies that I love, the person just lays in a sort of an MRI sort of table kind of thing, and it scans the person from head to toe, and it realizes, the movie's Alien, my friends, and it realizes that there's something there. And then it knows how to go in and get it and all of that, but it's all done by the machine, even the surgery. But as Dr. Pearl said, there's still a doctor there. There's always a doctor that's present, even in Star Trek. There was a doctor, even though there were tools that were more like AI sci-fi, what many of us would call this era that we're in. There was someone there to disseminate the information and disseminate it in a way that all of the data that you have now makes a little bit more sense and brings that uniqueness to you. But there are people, Dr. Pearl, who are afraid. They're afraid because of things that they've heard, or they're afraid that this access to their medical care is compromised, which sometimes when we do these searches, we find out that these algorithms hold our searches and all kinds of things, and scams are happening because of that. So how are people protected through this new GPT? And you said GPT-4 is the most recent iteration. How are they protected?
I think you've positioned the conversation perfectly. Really a beautiful description. It's a combination first of a dedicated clinician, an empowered patient, and a powerful generative AI tool. It's not one or the other. It's not one replacing the other. It's the power of the triad to provide that opportunity. In the book ChatGPT MD, there's 5 parts. The first 3 is about the technology itself and its application, how it can help us manage chronic disease, improve health, lower healthcare costs. Hopefully we'll get into that conversation in a few minutes. Chapter 4, though, is what you're describing. It's about the challenges and the problems. 5, by the way, is about leadership, an area that I know is very vital to you. But in 4, we talk about privacy, security, bias that you and I have talked about on previous shows, misinformation. These are realities that exist. The question, though, and this is I'd say a mind shift that I recommend to people, is don't ask yourself, is the technology perfect? It won't be perfect. Ask yourself, is it better than what we have today? Today, what happens, it's not like people don't do anything. They go to Google and they click on a link. Remember, those links are paid for by advertisers. Your privacy is not going to be privacy there. Generative AI, at least so far, and I use ChatGPT. By the way, I have no relationship to OpenAI. It's also Gemini from Google. It's also Claude. It's a variety of different tools. They're paid on a subscription basis. Okay. And a subscription basis means that there isn't advertising. So I think the risk of a privacy breach becomes less. Security. We know that the electronic health record has a massive amount of information. This is just the reality today, and this technology won't be able to avoid it. But I also think that what the technology will be able to do is, by empowering you, it will allow you to see many of the challenges and problems that exist in medicine today. You know, it's interesting. When my dad, 2007, my dad bought an iPhone. I thought that was amazing. Was he a technological cutting edge wizard? No, I said, Dad, why are you getting an iPhone? I mean, it was a great idea, but why? He said, I plan to lock it in the trunk of my car. And if I get into an accident, I'll be able to get help. That was his notion of the iPhone. Had one use, be able to get help in terms of an emergency. So then you think about all the ways it permeates our life. And for all of its problems, I don't know anyone who would give it up to go back to where we were before. That's how I see generative AI. Mm-hmm. So should people be cautious? Absolutely. Is it ready for prime time today? No. It still has problems that need to be addressed. But I want people, and I wrote the book. By the way, ChatGPT was my co-author. I went back and forth with ChatGPT hundreds and thousands of times. I loaded into the application the 1.2 million words that I had published previously. And although I'd say that most of the book is me, supported by ChatGPT, I did leave in one chapter for readers who wanted to see what ChatGPT, predominantly on its own, 90% of the chapter was able to create, because I want people to just understand this dawn of this new era. What is possible This is not what should change in 2024, but this is what will change before 2030.
And you talked about in the book also talking about the finances, and we know, I mean, here at Alzheimer's Services of the East Bay, I have not seen the cost of providing care go down. On the contrary, it has gone up. A lot of it has to do with the cost of medications rising. A lot of it has to do with family members not being able to access systems in ways that now with managed care and different things, there's just so many layers of bureaucracy in many ways. And I'm not putting down my colleagues that I work with, because they're just trying to shuffle through it and figure it all out themselves. How does and then the emergency room, I know for our folks, the emergency room becomes a place of care, not a place for emergencies. And so how does all of this GPT and this new AI movement, which we've been moving into for over a decade, if not more, will that help in some of this? I mean, will it also be the impetus for us looking at some of the vendors that now are sucking up some of those dollars, because we can see things a little differently? And I hope I worded that properly.
No, again, you're absolutely correct about the challenges that we face. The estimates from the federal government are that healthcare costs are going to rise. You ready for this? By $3 trillion a year by 2031. That's 7 years from now. Does anyone believe that our nation can spend $3 trillion more dollars on healthcare for not any better outcomes that we're getting today? Do we not think that if we invested $3 trillion in education, or invested it in helping people with job training or housing, or all the variety of social needs that we know exist, that we couldn't get better outcomes as a result? I don't think so. So I think the fear I have is that on the course which we're following, rather than $3 trillion of added costs, we're going to see added constriction, constriction and restriction of medical care. And people are going to find it more difficult to access care. There'll be more prior authorization, more limitations, more difficulties. So I think that the course the American medicine is on now is one that's going to hit a brick wall sometime over the next 7 years. So why am I so excited about ChatGPT? Because it focuses on health.
Yeah.
It says the following: chronic disease affects 60% of Americans. People on Medicare have 2 or more chronic disease, 75% of them do.
Yep.
And the complications of the chronic diseases, we're talking about diabetes, hypertension, asthma, is major life problems, threats to our existence: heart attacks, strokes, cancer, kidney failure. And I pose the following question: if we could reduce those complications, let's say by 30%, and that number is not made up, we have evidence from the leading healthcare organizations that it can be accomplished, but it's accomplished with a lot of people having to do a lot of work. What would happen to American healthcare costs? It would go down dramatically. What would happen to life expectancy? It would go up. What would happen to people's day-to-day health existence? It would improve dramatically. So the question now becomes, how do you accomplish it? As you pointed out very positively, and I thank you for it, my previous books looked at the same issue. And they came to the conclusion that these changes needed to happen. They must happen. They're the right things to happen. But what I didn't know was, how would we accomplish it? The generative AI tools now in people's homes, helping them to use wearable devices to monitor their health, provide feedback, offer opportunities around lifestyle medicine, improving diet and nutrition, mental health, relaxation, being able to more effectively, as you say, use the ER for emergencies and have alternative means of getting care for the day-to-day kind of problems, some of which don't need help and some of which need immediate help, and figuring out which is which. That's what I see it being. And if we can lower the chances of getting a heart attack, stroke, cancer, kidney failure, infections by 30%, we'll have a healthier nation and one that is one in which healthcare is more affordable. But I want to add one piece here. This is important to understand. The technology alone won't be enough. We also have to change the reimbursement system. Right now, we pay clinicians on a fee-for-service basis. The more you do, the more you get paid. If you do something twice, you get paid twice. In fact, if you have a complication the first time and have to undo it, you get paid a second time. It's a system that is outdated. It's left over from the last century when the problems people had were relatively straightforward. Appendicitis, an appendix had to be taken out. Pneumonia, antibiotics had to be given. Right now, what medicine has is far more complex. The system doesn't work, and it actually penalizes clinicians who maximize health because they don't get to do the things that patients need. So we need to move to some kind of prepayment, pay for value, capitation, lots of words that basically reward the clinicians for maximizing health, avoiding chronic disease, avoiding the complications of chronic disease. And when we do that, ChatGPT, generative AI, becomes a powerful tool to accomplish it. But you also talked about a very important thing, which is Alzheimer's disease, an area that, of course, you are a world's expert in. And the challenge we have there is we don't yet have a great understanding of the problem. We don't know exactly what causes it. We have some ideas. We don't have a great treatments. We have a lot of things that will work. We need to get far better in that particular arena. And I'm hoping that things like generative AI will assist, because now if patients are putting a lot of information about their symptomatology, about their progression in mental competence, about their associated issues that are there, they and their family members, we're going to learn a lot. And in learning a lot, we may be able to get insights that are going to improve that performance. And at a minimum, we can start to offer services at little or no cost that today are incredibly expensive and out of range for quite a number of families.
Well, and I love that you say that, because up here at UC Berkeley, we have the Centros Academy, Dr. David Lindemann, and his students from time to time will come here and talk about AI and things like making a carpet that is, and this is a decade ago, a carpet that's by the front door, so that when someone has an exit-seeking behavior because of their dementia, there's an alarm that goes off in the caregiver's bedroom, so they're not locking the door and creating Fort Knox in their home, and they're keeping that home environment. Oh my goodness, what an option. You know, things like taking a baby monitor idea and changing that around to where it helps someone live in their home in the early stages, all the way sometimes to the moderate, but yet their family can use their phone to check in, like I do with my dog. You know, I mean, so again, or just any a number of things that would make the caregiver experience and take some of the burden away from that caregiver, so that they too can have a quality of life with their loved one. And you know, Dr. Pearl, this is what you're talking about, but this is my social concern. When I end this conversation with you this morning, I will be going to an area agency on aging meeting here in Alameda County. And what we learned, as you already know, because again, you spoke to it in your books, there is a digital divide that exists between brown and black and low income socioeconomics. So we have this divide that discriminates individuals from even understanding, I mean, even having a cell phone that has the right bandwidth, that they, you know, they may have a cell phone, but it can't do certain things, or you can't download apps because it's a cell phone that is supported by government dollars. Where do you, how is this going to shift, or what do you see as the shifts that need to happen so that this whole GPT AI is for everyone?
What you're describing is the social determinants of health that have been demonstrated to be equally and maybe more important than actual medical care we provide. Whether you're living in a house that's safe, that doesn't have a lot of fungus and other pathogens floating around, you have safe drinking water, that you have a job that pays you a wage that you can live on, that you have the tools that you need to be able to start to live a healthy life. This is essential. We've known that. One of the challenges is that some of the pieces are very expensive, and no one's yet been willing to make the type of investments that are needed, and the political force has not been there, the political will to make those changes happen. What I like about generative AI is that the cost is relatively low. It's not zero, but I'm hoping that the cost is low enough. We're talking about the equivalent of a latte a week, that it will be included in Medicaid as part of the benefit because it's there. It will be provided by the government to people who are, maybe not able to qualify for Medicaid, but still not able to afford what is a relatively small amount. Because think about that. You're investing, and again, I want to stress the fact I don't have any direct relationship with any of these companies. I have no financial investments, as you say. All the profits go to Doctors Without Borders. But if you invest $20 a month, which is $240 a year, and you can save a few $1,000s by avoiding heart attacks and strokes and cancer, that's a pretty good return on investment. Yep. And so, when it's a question of putting in millions of dollars, I think there's a lot of resistance and hesitancy. Here we have a big opportunity. You can access this type of technology on your phone, on your computer, whether it's cellular, whether it's going to be broadband. And I'm hoping that increasingly this will just become a commodity. I tell people that ChatGPT will be the equivalent, generative AI will be the equivalent of what the smartphone was in the past, 2007, where we didn't have the tools and applications. People didn't know how to use it. And it took a full decade.
It did.
It became ubiquitous. Now we're talking probably in the 3 to 5 year range, a third or a half of the time.
It's so funny you say that because, the flip phone came back out. And I broke my phone, and my son and daughter, a millennial and a generation, what is she, X, Y, Z, I believe, they replaced the phone for me because I was at a conference and I was like, I need a phone, so help me. And they did, and the phone arrived, and I had no clue what to do with the phone. So they came up, they did all the programming and dippity-doo-dah. But not only is this a phone, but now it's my my remote web thingy, server thingy that I can hook to my computer and my laptop to the server at my house. What? It monitors my blood pressure, my steps, so it's more than a phone. Now, the problem with being who I am is that I didn't understand all that until it got pointed out to me. And so it's an education for people when they get a phone now to understand the number of apps that they can download that are health related apps. And so I just want to make sure I explain this for our audience. The health related apps that you download to your phone use the data that is downloaded into your phone to execute a particular function, and then those functions then can be used. Like there's one that does blood pressure, like there's a ring that it does blood pressure, all of those things, but it stores all that data so that when you go to the doctor, you can say, this has been my blood pressure for the last 7 months or the last 6 months or whatever. This is a version of what we've been talking about this morning, correct?
Well, it's a start, but the challenge is very few doctors have the time today to look at all those measurements and review them and analyze them. And this is going to be the next big step, which is that you're describing the wearable devices.
Yep.
It generates all the data, it stores the data. But how about if a AI tool analyzes it for you? So every day they tell you how you're doing. Now they tell you that your blood pressure is going up. The medication the doctor ordered last month doesn't seem to be working. Rather than waiting 3 or 4 months to your next visit, you now have that information. Across the US today, we do a poor job. We manage hypertension effectively 55 to 60% of the time. It should be over 90%.
Oh
You look at
no.
something else, diabetes, far worse, less than half of the time. People have estimated maybe as few as a third of the people with type 2 diabetes, an ever growing problem that's going to impact a third of Americans. Only less than a half, probably less than a third of the time, we appropriately control it. This is the leading cause of kidney failure. This is a major contributor to heart attacks. We have this opportunity, which you're describing as step one, which is the data, and step three, which is the clinician. Generative AI becomes the intermediate step two that informs you how you're doing. And I'm hoping that some of the things it will do is to tell you, the problem is getting worse because of something about your lifestyle, and offering you opportunities to improve diet, to generate more exercise, more mental health relaxation, all the opportunities that are there. You can think of it as a life coach, as a health coach, as a clinical expert sitting in place, not to replace the clinician, but to augment it, to fill in the gaps, to avoid you falling through the cracks. These are the opportunities that are literally right on the horizon.
And Dr. Pearl's book, ChatGPT MD, is available to you now on his website. You can get it through Amazon. I'm waiting for mine to come, and I'm excited about it. I have learned so much from all of the books that Dr. Pearl has written, these conversations. And I just want to summarize a little bit, and then I'm going to ask Dr. Pearl to just give us his last words of pearls, pearls of wisdom. It is so important that you are engaged with your health care. It is so important that you understand what is out there that can benefit you and support you in that journey. This is it. I remember I always tell you that I'm always searching for new things in like CQ10. I found out about CQ10 about a decade ago. And so my immune system is different now because I've been taking it. Dr. Pearl talked about high blood pressure. I was a person that was on the border. They were getting ready to give me medications, and I did my homework on the internet to find out all the different things that cause high blood pressure. I started, oh, it's stress. I live a stressful life. Let me tell you, that wasn't it solely. It was what I was eating. It was my lack of exercise. It wasn't going to bed on time. And then the things that bring me joy, I was using less of my life force and time in those spaces. So it wasn't just one thing. And I didn't eat salt, so it wasn't that. Okay? So you've got to really realize this is your temple. I'm gonna go biblical on you. This is your temple. And you can't expect somebody who just sees you every once in a blue moon to understand your temple. And reading Chat GPT MD and getting also the other books by Dr. Pearl, go to his website. He has a wonderful blog himself. He has a newsletter. Get engaged so that you can also ask questions. When I go to my doctor and I ask her questions, she's like, she always laughs. She goes, Michelle, you're amazing. Where did you read that? I said, I just want to know, is this something that's good for me, not good for me? Dippity doo dah. Be engaged, be involved. And the more you know, the more you will be able to care for yourself. I know we're all living, Dr. Pearl, in this world of longevity. Like that's the big buzzword, the blue zones, and we all want to live forever. That we're not, okay, friends, we're not. But at the end of the day, we can live a long and fruitful life. And a part of that is your health care. All of it, to me, is your health and mental health, those things combined. Without those things, who cares how long you live if you're sick and you can't engage in the world, right? I mean, we're talking about quality as as Dr. Pearl always says, quality of life, quality of life. And it's contextual because we all have different values that we bring to that. So Dr. Pearl, before we go, and again, we're going to reschedule you sooner than later because I really would like to talk about the pandemic because of its impact, not only on myself, but on the nonprofit world, on the medical world, and on the world, meaning humanity. So we will have Dr. Pearl back for that. So look out for that in the future. But before we let him go, I really would like him to share with you his last pearls of wisdom as it relates to the conversation that we've had this morning. And Dr. Pearl, thank you again for joining us.
Well, thank you for having me today. It's always a privilege to be on your show. The words of wisdom that I would offer to people is we are at the dawn. And I want everyone, I want the patients across the United States, the clinicians across the United States to lead the way, because if they don't lead the way, someone else will. This is not the time to abandon the care you're getting. It's the time to augment that care. I'm encouraging people. I wrote the book, by the way, with ChatGPT because I wanted to get it published in 6 months. My previous books took 2 years between writing it and editing it and typesetting it and printing it and distributing it. We didn't have 2 years. By 2 years from now, anything I've said today will be out of date because that's how fast the technology is going. And I want to encourage people, join groups, come together around health with your friends. Go to the church. Maybe the church can lead the area, or the community center, or all the different places. Why does every person have to invent this? Use the example of your phone. Imagine if there's a place you could go to where expertise and information would be shared by all the people who are there. As you pointed out, your kids have that information, but there are other things they don't know that you know. So how do we create a learning community? That's what I believe. Everyone should try it now. There's a free version out. It doesn't cost anything. It's the one prior to GPT-4. It was GPT 3.5. But it's a free version out there now. You can download it on any smartphone, download it on any computer, and you can start to see what this technology can do. And as you said so clearly, focus on health. We've had a sick care medical system. And if you're really sick, we need sick care. But we fail to have a health care system. That is what is needed: prevention, diet, exercise, communication, community, empowerment, knowledge. These are the kinds of opportunities that we have not paid the attention to because we've not had the tool. Now we have it. ChatGPT MD tells that story. And I'd love to hear from anyone who buys the book and reads the book. What do you think? Where did I go wrong? Where are the other opportunities that I may have missed? And thank you again for inviting me today.
Oh, Dr. Robert Pearl, ChatGPT MD, how AI empowered patients and doctors can take back control of American medicine. And Dr. Pearl just dropped something in my heart. I'm going to start a health group within my church because that we need that as we go through these diseases, chronic diseases, and it's being in community that makes it happen. I want to thank Dr. Robert Pearl, who has become a dear friend of Life is a Sacred Journey and a dear person and a friend to me. This weekend, I would like you to put on your calendar, Dr. Pearl, the California Coalition for Youth is having their summit this weekend, and they're talking about the very things that Dr. Pearl talked about today, AI and its impact on their environment, their world, their culture. They're also talking about mental health and what needs to be done to support them. And so if you're out there and you're a youth and young adult, go to the California Coalition website, sign up. There's still spaces for you. It's in Sacramento, and there will be opportunities for your voice to be heard, because who knows what you need if we don't hear from you. We just assume, and I'm here to tell you it was a long time since I've been a youth or a young adult. In my heart, I still am, but I'm not. The other thing, as Dr. Pearl talked about, if you are out there right now, and I always share this with you before I say goodbye, If you're feeling sad, if you're feeling lonely, if you're feeling anxiety, if you feel that suicide is the only path that you can take, 988 is a number that you can text, call, email. I even heard the other day. Get to them. There are professionals who have been trained to talk to you, to listen to you, and to help you to know that you matter and the ripple effect of you taking your life. I felt it once myself. I thought the world, it won't matter if I'm not here. Who cares? Guess what? It does matter. Now that I've lived long enough from that moment that I felt that, it does matter. And what I'm doing right now is because of that moment. Okay? So I know the world is hard. I can't even tell you. Dr. Pearl couldn't even tell you. It's hard. It sometimes, I'm gonna use the word, it sucks. But get some help. 988. The world would be a horrible place without you. Dr. Pearl, you agree with this sentiment?
Completely agree. We're seeing rising rates of mental health issues, people harming themselves, suicide, and it's secondary things. Over 100,000 people die annually from drug addiction and drug overdoses. We're seeing it in the schools. We're seeing it in the relationships. No, this is a time where we need to focus on mental health and make sure that we improve the physical health, the mental health, the spiritual health of our nation. And if we do so, it will be a far better world for all of us. And thank you for leading the way.
All right, friends, have a great weekend. Get out there, hug a tree, pet a cat, pet a dog, hug a person, hug yourself. Get out there, because the world cannot change unless we change ourselves. And a part of that change is being connected. Dr. Pearl and I have never physically been in the same space, not yet. We're going to try to make that happen sometime in the near future. But it doesn't mean that we don't have a relationship. It doesn't mean that ChatGPT MD is just something that I'm bringing to you because of Life is a Sacred Journey needed a guest. It means this is a part of a future that is pivotal to you as caregivers and to you living through your medical plan. Be well, friends. Have a great weekend. I'm off the next 2 Fridays. I won't be here because I'll be in Charlotte, North Carolina doing church business. But know that I'll still be caring about you, and Felicia will make sure you get what you need. Take care. Have a great weekend. Peace.